This is a WAAY 31 News special presentation.
Tonight, we are taking your questions straight to the experts. Welcome to our WAAY 31 special report, Coronavirus Concerns. I'm Dan Schaefer. My colleagues are going to join us throughout the show. It's important everyone stays 6 feet apart from each other and equipment gets wiped down, so we have put this show together with those things in mind. Just another example of how coronavirus is forcing everyone to change their life. The next hour is all about getting answers to your questions. So if you have one and haven't sent it in yet, now is the time to do that. You can do it from your phone, your tablet, your computer. Just send an email to share@waaytv.com. One click, simple, easy, and we will try to get those answers for you. Let's introduce you now to whom you're going to be hearing from over the next hour. Dr. Ali Hassoun is an infectious disease specialist with Huntsville Hospital. Dr. Richard Myers is with Hudson Alpha Institute for Biotechnology. Dr. Karen Landers is with the Department of Public Health. Nicholas Patelis is a family doctor. Morgan County School Superintendent Bill Hopkins joins us. Jasmine Butler from Wellstone Behavioral Health is here. And Anderson from the Care Assurance System for the Aging, and Huntsville Mayor Tommy Battle. Clearly, there are a lot of different people from different professions, lifestyles, different backgrounds. It's because coronavirus impacts all of us, and in a lot of different ways. It's putting everything we know about life on hold and creating a lot of questions. So we're committed to getting those answers for you. Send your questions again to share@waaytv.com. We're going to leave that email address on the screen all hour to make it easy for you to remember to ask those questions. I'm going to send it now over to my colleague, Naja Sherman, to get the Q&A started. Naja.
All right, thank you, Dan. I am joined by Dr. Nicholas Patelis, Jasmine Butler, and Ann Anderson. So let's get right to the questions. The first question is from Jana, and this question is for Dr. Patelis. She asks, with all the rain that we've had, it's created a lot of mosquitoes. Should I be worried about mosquitoes transferring the virus from one person to another?
That's a great question. From our perspective, we haven't seen any transfer from using the insects as a vector from transferring from one person to another. There's been found some viral load within the blood, but not extensive enough to be spread. So therefore, right now we're seeing from person to person through droplets, respiratory droplets, that is. So I would not worry about vectors from mosquitoes from my perspective at this point.
All right, thank you, Dr. Patelis. And this next question is best answered by you. And maybe you can go into a little deeper into what is being done for older adults. Eugene asks, what stores offer senior hour and the shopping time?
Well, I can tell you that Publix right now is offering shopping days, and that's on Tuesday and Wednesday mornings starting next week. And that starts, I believe, at 7. We have also heard from Dollar General, Dollar Tree, many of the stores. As this progresses along, we're just seeing new information coming in every day, every moment, and it changes. And I appreciate sincerely that the local retailers are making this accommodation to the most vulnerable population when it comes to this virus.
Absolutely, it is encouraging to see many stores doing that. Thank you. And here's another question for Dr. Patelis. Sam wants to know, is it safe to order big packages from Amazon?
Good question. I guess the big question really is the virus. Is it still present on inanimate objects? And it's been found that things like cardboard, not so much. It's porous, so the virus tends not to be as much on the porous material. But what I recommend actually is the quintessential component is washing your hands. So one point is you can certainly wipe the package down with alcohol-based wipes, but also it's important when you open up the package for sure to wash your hands well thereafter. So as far as shipments coming in from the Postal Service or ordering supplies otherwise through the mail service, it's safe. But I do recommend, as everyone does, wash your hands every time you use something particularly.
All right, thank you, Dr. Patelis. Let's open this next question up to everyone. It's from Tracy, and she wants to know why people are still going to parks and letting children play on the playground.
That's a good question. The underlying mantra in the whole thing is social separation, social distancing, if you will, because we're trying to maintain we're trying to mitigate the spread of the virus in hopes of spreading out the overall infectious process, and therefore in doing so we'll will prevent the underlying burden on our health services. So why I think one part is that we don't necessarily see it as a threat or don't take it seriously as a threat in many ways, but we should, particularly because when it hits us at a grand scale, as it has in China as well as in Italy, it's going to hit us fast. So this is the time to do it now, especially the younger folks, in isolating ourselves, at least by keeping that distance of 6 feet or so. That will prevent us from spreading it to others. Because if you look at the other studies or other countries, we've actually seen that about 80% approximately of those that have had the infection are carried through asymptomatic individuals. So we don't even know in many ways. So it's best at this point to really maintain that social distancing process, the whole idea, and try to get out of the idea that this is a vacation for the younger folks.
This next question is probably best answered by Ann, but I think all of you can talk about the overall issue. Jill asks, why can't they do something about these people hoarding the grocery stores and not leaving anything for us seniors, elderly, and disabled people to get food? This has been a huge issue.
And it has. I think it's because we're all in a crisis operation, and we're mode of operation these days, and we're worried about not having enough resources. That's why these additional hours, and they're gradually adding in deliveries again to people. So I think we'll see a slowdown in that. I hope. The companies are managing to produce the products we need. There's no scare that we're going to be running out. We've been reassured by our federal and state governments that that's not going to be an issue. But it is sad. Fortunately, I haven't spent much time in the grocery store since last week. And I was at a couple of the stores, and people were being very civil and respectful and listening to what the store limits were. You know, they're limiting people, and I think that's going to help us a lot too. So it is a concern initially when something like this happens.
This one is from Missy, and she doesn't as much ask a question as she makes a statement. She says, if you don't have anyone in your life elderly or immune deficient, then kids should be just fine. No reason why kids can't play with each other. Best to keep them out of public places where they may be with those type of people. So what do you all think about that statement from Missy?
I guess my concern is, and then I'll turn it over, is, you know, I have a grandson that has type 1 diabetic, just been in the hospital twice since January. I know that my family are keeping him separated from others, and also as a grandmother, they're keeping me away from him, because you don't know, as we've been told, we don't know how this virus is mutating. We don't know who's a carrier. So that's my personal take on it. I think we have a responsibility to think about what the potential could be. We don't know.
That's very true. We don't know. You know, I think again, we need to take it serious in regards to keeping ourselves separated at this point for the next several weeks, and the duration of time we're not sure as well. But the important factor is that by maintaining that social distancing, we're protecting not just ourselves, but we're actually protecting the mitigation and the propagation of infection, particularly to those that are at the highest risk. The immunocompromised, those with multiple comorbidities, such as diabetes, heart disease, underlying pulmonary disease, individuals greater than 65 years of age. Those are the ones that are going to get hit the hardest. They'll sustain much greater respiratory needs, and their reserve overall is considerably less as well. So it's important that we take it seriously, and I can't emphasize that enough in regards to those that aren't having symptoms or really have low risk. The younger folks is to break that propagation of infection, passing it on from one to another.
Flatten the curve, as we say. Well,
Exactly.
another question for Dr. Patelis. Charmaine asks, what is the difference between coronavirus and the flu in terms of being contagious?
Good question. The coronavirus and flu virus act very similarly in regards to contagiousness. The biggest difference really in between the novel coronavirus and the flu is that we've had in general population, we've had already been exposed to the flu in more ways than one. We also have vaccination to the flu. Approximately 40 to 50% of the nation get vaccinated. So you have this not only prior exposure to the flu, but you have a herd effect, which means one person is already protected against it. They're not going to pass it along. The difference between that and the coronavirus that we have now is that no one has been exposed to it before. So what's happening is everyone is going to get it. And we estimate approximately about 60% of our country will be exposed, will actually have it. That's a high number. If you think about, we're about a third of a billion in population. So again, the big difference is our previous exposure to this virus. We're naive to it, therefore we don't have any protection intrinsically or extrinsically, either by self-exposure in the past or by a vaccine, because we don't have a vaccine to it at this point.
We have one more question. This is from Chastity, and she asked the question, am I still practicing social distancing if I'm going to my mom's house? So Jasmine, can you go into a little more detail on social distancing and how it may impact families?
Well, I think right now everyone's kind of in a state of anxiety, and if visiting family members and friends safely, in a safe manner, abiding by what the CDC has issued as our rules and regulations, if visiting our family members and friends is going to help reduce anxiety, then absolutely visit your mother, your grandmother, anyone who may need some additional support right now, because anxiety is definitely rising. We're seeing this amongst our children, even our adults. And so the extra support, the connection really could help with helping them get through this time of crisis.
All right, thank you so much, Jasmine. A lot of great information, and a lot more is on the way. Next, we're going to learn more about how scientists are fighting coronavirus. WAAY 31 anchor Marie Waxel is with Hudson Alpha Scientists to get answers about what makes this virus so unique.
Welcome back. I'm WAAY 31 News anchor Marie Waxel. There's a lot of information being spread about the coronavirus. Some of it's true and some of it's not. So we want to take a moment and break down some fact versus fiction for you and let our experts really drive home the facts for you. Some of the more common myths out there right now are if you don't drink enough water, the virus can enter your windpipe and lungs. Gurgling water with salt will prevent coronavirus. If you can hold your breath for 10 seconds, you're okay. Now, those are just 3 of the more popular fictions circulating online. It's why we put together this WAAY 31 special report, Coronavirus Concerns. It's a question and answer session with top leaders in the medical field and public officials to help keep you safe. Get your questions answered right now. You can email us at share@waaytv.com. Joining us now via Skype is Dr. Richard Myers from Hudson Alpha. Before we get to specific viewer questions, Dr. Myers, first of all, thank you so much for joining us. And can you explain how Hudson Alpha plays a role in the battle now against something like the coronavirus?
Yes, thank you, Marie. Hudson Alpha is a nonprofit research and teaching institute. We develop and use technologies in genetics and genomics. That means all living organisms. We work globally on diseases, sustainable agriculture related things. We're now working and have been working on microbial problems and are working furiously on this COVID outbreak. Our founders had something really special they did. They wanted not only to have this nonprofit academic style research and teaching institute, they wanted to have biotech companies on the same campus. We have 45 of these companies and we work in partnership with them. And several of the companies, along with scientists at the institute itself, and these include the companies are Diatherix, IQBate, and iRepertoire, as well as scientists in the institute, are doing a variety of things. One of them is development and application of testing people with symptoms, and you will hear more about that. And importantly, the development of potential treatments.
Okay. All right, let's jump right into some of our viewer questions, if you don't mind. Billy asked this next question, and it's definitely a scientific question, perfect for you, Dr. Myers. Coronavirus is an RNA virus, and in some RNA viruses, it's the RNA rather than the DNA, which carry genetic information. Could this transfer mutations from one patient to another?
So indeed, this SARS-CoV-2 virus is an RNA virus. Lots of them use RNA for their genetic material rather than DNA. And it mutates just like DNA viruses, but other RNA viruses as well. It mutates. It's easily passed from one person to the next. And it's not just the mutations. The harmfulness comes from how infective or how contagious it is. And that can be true especially in older people. That can be true regardless of whether it's an RNA or DNA virus.
Okay. Brennan wants to know why there aren't enough tests for everyone.
So that's a really good question. Our country was a little slow to respond, and this did set us back. That's happened in other countries. Some have been faster to respond. It doesn't matter what happened backwards. Let's do it now. And clearly, testing is a critical part of this. Fortunately, many groups throughout the entire country are stepping up to greatly increase testing. We need hundreds of thousands of tests. Testing should be done on people who have symptoms, not asymptomatic people. Otherwise, we will inundate the testing even as it's expanding. And also, you could get a false sense of security from a negative test if you don't have symptoms yet. So we are certainly part of that solution of ramping up significantly the number of tests per day to the thousands. And this is done by, at least now, by our company Diatherix. And that you don't come here to have the test done, you do it through your healthcare providers and the various centers that you're hearing about, so that you can get those done. And thank goodness we have this, but it's going to need to be ramped up everywhere.
We actually heard during the news briefing earlier today that you guys are taking part in helping to get those test results back quicker. That's true, right?
Yes, the wonderful thing about actually the Diatherix test and actually the one being developed by IQBate is that they're very rapid tests. They also test for additional respiratory pathogens, which is an important part of this as well. And the results can come back in hours. And of course, one of the things that's nice about having something locally is that it's even quicker then. But even if samples are sent through healthcare providers, from afar to the through physicians to dietherics. It's still, they receive the samples in the morning, they have the answers by the afternoon.
All right. Joey wants to know if there's any chance the virus could mutate into something more serious than what it already is.
Oh, that's a really good question. Of course, we're all concerned about this. We don't actually know the answer to that. It's already pretty serious, and all of them mutate. It could also mutate potentially to something less virulent, meaning less contagious. I think there's no evidence that the mutation rate of this SARS-CoV-2 virus is any faster or worse than other viruses. It's just the symptoms and the contagiousness that are the serious problems. So the sooner we sequester, stop the spread of it. Testing is an important part of that. And obviously, the sooner we get treatments, the better we stop it.
Absolutely. Now, this next question comes from Kendra and is really one of the most common questions that we're being asked here. How long will the virus last? Is it 8 weeks, 12 weeks?
So again, a great question. And of course, everybody in the world is wondering about this. We just don't know. We don't know the life cycle of this virus and the population dynamics of this virus well yet. Again, there is something encouraging. The fact that China reported yesterday in a country of 1.8 billion people or more, whatever the number is, not a single new case arose. Pretty draconian measures of keeping people separated, and that and quarantine when they are symptoms clearly can make a huge difference. I think different countries deal with this in different ways, and I think we're starting to do this right here. And the faster we implement and really pay attention to the experts here, the better, the faster that it will end. I'm not going to put a number of weeks on it because we really just don't know.
All right. Now, a couple more questions for you before we let you go. We started this segment talking about some of the coronavirus myths. Anne wants to know something along those lines. She says, I've heard that if you have A-type blood, if you get the virus, it'll be bad, but if you have O-type blood, it'll be a mild case. Is this true or false?
I have not heard that sort of rumor myself yet. I would be seriously doubt that there's anything to that at all. I think that's the danger in us exchanging information so rapidly. How do you get the best information? And I will say, this is ever changing. There could be some new discovery tomorrow about how it acts. And I think everyone should be paying attention. Pay attention to the experts. I mean, the Centers for Disease Control is particularly good at this. Anthony Fauci at the National Institutes of Health, giving really, really good information. And I think all of us, the cities around us, our state, certainly Hudson Alpha, are getting the best information we can and trying to disseminate it that way. But I'm not going to say absolutely the blood type doesn't make a difference, but I'd be very surprised.
All right. And one last question for you, and it comes from Matt. This is something that we all want to know as well. When will a treatment or vaccine be available? I know there's a lot of stuff out there in clinical trials right now.
I can't say when. I think everybody knows that this is really, really important, and they're working really hard. I think not the rules aren't being thrown out the window, but certifications and things like that are moving much more rapidly. We are working on. I'm very excited. Our associate company, iRepertoire, led by faculty member Dr. Jen Hans, is working really hard on trying to develop an antibody treatment. I just hope there are 1,000 other groups like that out there doing this, and we try to keep up with them. There are some exciting things. I think that it's still going to take some time, and I believe there will be breakthroughs, and I will say there won't be a cure. There will be multiple types of ammunition that we throw at this virus, and the more people working on it and sharing data, the faster that will happen.
All right, well, we certainly hope so. Dr. Myers, thank you so much again for your time and for joining us here. We do appreciate you and all the work that you guys do at Hudson Alpha. Now, coronavirus isn't the first time we faced a deadly virus or disease, and it certainly won't be the last time. Next, we're going to show you how we fought epidemics before and why there's plenty of reasons for hope.
Welcome back. I'm WAAY 31 News anchor Dan Schaefer. You know, mankind has faced pandemics and plagues since the beginning of time. We've always survived, no matter how hard we've been hit, and we have been hit hard. They actually happen a lot more often, in fact, than you realize. Back in 1968, the flu pandemic killed about 1 million people, started in Hong Kong, and in less than 3 weeks spread to India, Australia, Europe, and the U.S. 100 years ago, in 1918, a flu pandemic is estimated to have infected up to 500 million people around the world. Somewhere between 20 and 50 million people died. That's a mortality rate of 10 to 20%. A lot higher than we're seeing right now with coronavirus. In 1889, the flu killed more than 1 million people for the first time in known history. Rapid growth at the time led to the virus spreading faster than it had before. Not all pandemics are flu-related. The third cholera pandemic hit from 1852 to 1860. It also killed about 1 million people. It started in India before reaching the rest of Asia, Europe, North America, and Africa. A doctor finally tracked the spread of cholera to contaminated water. Joining me now in the studio, Ali Hassoun from Huntsville Hospital and Karen Landers from Alabama's Department of Public Health. Hope you guys brought your hard hats. Viewers have come up with some tough questions for you. Let's begin with a question from Kevin directly for Karen. Now, we know the Health Department, of course, has been working around the clock. Karen, he wants to know, why does the Health Department not provide regularly scheduled updates such as 8 a.m. and 3 p.m.?
Dan, thank you for that question. And actually, this is an issue that we have discussed today with our state health officer about being able to have some regular updates, perhaps on a daily basis, so that we can provide more information. Of course, as you know, the information is rapidly changing, so we do update our website daily. And again, we hope to have either a media briefing or a YouTube briefing or another way to provide this information to the general public. Thank you.
And of course, WAAY 31 has been covering your news conferences as they happen. Ernie has a question about ventilators. Dr. Hassoun, he wants to know if people can use their CPAP machines as a ventilator to help with their breathing.
So in general, the main concern with CPAP is actually transmission more of the virus in compared to the ventilator. In our hospitals, we actually prefer the ventilator because what we call it is like a closed circuit. It will reduce actually the transmission of the virus in compared to a BiPAP or a CPAP in these cases.
So not the best idea. All right, Ali, this one is also for you. Keisha asks, is Huntsville Hospital required to submit their positive tests to the CDC? Someone is saying they tested positive in Huntsville and the hospital is not reporting those numbers.
And I'm going to say that's not true. So all reported positive cases are going to be sent to the Alabama Department of Public Health, and that get reported to actually the CDC as well. So every case that's positive going to be reported and counted.
Charity wants to know, how long can the virus live on clothes, hair, and other surfaces? Karen, does the Department of Health have any advice on that?
Yes, we do have some information on that. Now, there has been discussion, of course, of the virus on hard surfaces such as plastic or metal that could potentially live up to 3 days. We do know that paper products are not really considered to be a good way for the virus to live on a surface. Now, as far as, again, as was asked earlier here, I think what we're talking about here is, generally speaking, the virus is still more likely to be spread by person-to-person transmission through respiratory droplets. And while surfaces, and certainly people can take hygiene measures to reduce the risk of spread from not only their hands, but also other parts of their body.
Dr. Hassoun, here's a question from Elizabeth about coronavirus symptoms. She asks, how soon after being exposed to the virus does one usually exhibit symptoms?
So most of the studies actually been published where it shows what we call the incubation period, meaning you get exposed to the virus. It might take you up to about 5 to 7 days where you can start exhibit symptoms. That can be variable between those who is immunocompromised, elderly, or healthy, but that's the general mean duration, 5 to 7 days, till they usually start exhibiting symptoms.
What is the prognosis for a vaccine? This question comes directly from Bob. He asks, what is the status of a vaccine and a virus treatment? Is the Department of Health any closer to that?
Well, again, I think that you can hear on the national stage, as well as information from organizations such as NIH, there is activity toward developing a virus. And I do want to mention that one of the antiviral treatments that might be able to be used was actually developed in cooperation with UAB. So again, I think the vaccine, how are we really going to stop a virus? It's going to be with vaccine primarily, and then how are we going to help patients, and that's going to be with antivirals.
Go ahead, Doctor.
And I can add to that is actually, so there's definitely some treatment that's in trials that hopefully it's going to be shown some benefit. There's already one been in trial, have been tried for coronavirus for the previous MERS and SARS, as well as other medication been shown some benefit. So we're really hopeful we might see some medication coming up soon that might be of benefit for the patients.
Karen, this question is specific to you also. Maribel asks for more information regarding total cases submitted, total cases pending results, and the number of recoveries.
Okay, well again, as I mentioned, we update our website twice daily regarding our numbers of cases. So our website is updated at 10 o'clock and also at 4 o'clock daily. Now again, if laboratory data comes in after 4 o'clock, we may not have that on our website until the next morning. As far as numbers of cases pending, well again, we have our positives that are reported. We do have tests in the laboratory that is in the process of being run, so I don't have exact numbers of how many they currently have to run. What I can say is that this week the Alabama Department of Public Health has run hundreds and hundreds and probably well over 1,000 tests, and we hope to have that data in the morning as far as the numbers of tests that we have run. We do know that commercial labs are also running tests, and we do not have their negative numbers, but we do have the positive numbers. As Dr. Hassoun had said, all reports of positives are reported to the Alabama Department of Public Health.
Thanks, Karen. Now, Dr. Hassoun, here's a question that really demonstrates how uneasy people feel right now. Melissa asks, is it safe to have my windows and doors open?
Absolutely. So this is one of the way you might think to have a better air going through. So one important thing to understand, the transmission of the virus is usually by close contact to a person who's infected. So if you have a better aeration through your home, through your schools or business, it'll be a good idea. So opening windows and doors is fine, definitely.
All right. We've seen a lot of cleaning products flying off the shelves at our local stores and supermarkets. Mike wants to know whether or not Lysol or bleach actually does kill the coronavirus on surfaces.
And I can tell you, so there's been studies looking at that, and it's been shown Lysol and Clorox is good enough to kill the virus.
That's good news. All right. Karen, Donna asks, why are people wearing surgical type gloves when they're out and about? Wouldn't the germs from a door handle simply transfer onto the surface of the glove?
Well, again, our recommendations are not for persons to wear surgical gloves out in public. Again, surgical gloves should be worn by healthcare professionals as they are performing procedures, including the nasopharyngeal swab or the swab in the nose for this specimen. So that's not really recommended because, as you said, the glove can become contaminated, so that we healthcare workers, when we use gloves, as soon as we finish the procedure that we are using the gloves for, we remove those. So again, gloves are not really protective. We certainly want to continue to stress good hand washing or the use of hand sanitizer.
And I want to add to that, you know, even healthcare professionals really don't wear gloves all the time. It's when in your contact with the patient. What makes the difference is washing your hands and be vigilant about hand hygiene and other ways of prevention, rather than wearing the gloves, which can be contaminated at one point.
Yeah, we've talked before, Dr. Hassoun. I know that's top of your list, always washing your hands. We have another question from Beatrice. This one, if you need a note from a physician to be tested for the coronavirus, how does a person who doesn't have a primary physician get a test?
So, and I can tell you, in Huntsville area, we, through Huntsville Hospital and Crestwood, as well as other primary care physicians, there's been effort to open what we call a drive-through clinic. For example, now Huntsville Hospital has opened on Governor Drive, a drive-through clinic where patients can go to be tested. We really do not want everybody to go try to get tested. We want those who have symptoms, got exposed, for example, have fever, cough, and shortness of breath. If it's mild, what we call moderate, to go there. If it's really where they're very sick, to go to the emergency room. We really don't want everybody to be tested because we need to reserve these testing kits for those who need it.
Okay. Karen, one quick question now for you. This one is from Mel. If someone does get the virus, would it be safe for that person to stay alone in a hotel in order to protect a medically vulnerable spouse?
Well, certainly home quarantine is a requirement of a person who does have the COVID-19 disease, and that person will also receive correspondence from the Alabama Department of Public Health as far as our investigation and follow-up. Certainly, if you are in a situation where you have a medically vulnerable person in your family, if you make other arrangements to stay in another facility, as long as you are following the self-isolation and the quarantine, again, it is reasonable to be away from that person if that is your decision.
Thank you. Karen Landers with the Department of Health, Ali Hassoun from Huntsville Hospital. So many good questions, a lot of information to take in. You'll be able to watch this later tonight on WAAYTV.com and then again on Saturday night. A lot more to come. Next, we're going to take your questions to Huntsville Mayor Tommy Battle to learn more about the city's plan to fight coronavirus.
North Alabama is slowly starting to feel the impacts of coronavirus. More cases are confirmed every day. Schools are closed. The U.S. Space and Rocket Center is closed. Court cases are now on hold. Coronavirus is also expected to impact this year's census. I'm WAAY 31 News anchor Pat Simon. Thanks for joining us. And joining us right now is a man connected to so many of the projects that I just mentioned, Huntsville Mayor Tommy Battle. Mr. Mayor, thanks for joining us today.
Thank you.
Mayor, before we get into the viewer questions, I know how important the census is to you and the city as we continue to grow. And as you know, the Census Bureau has announced a 2-week delay for protection purposes. But in general, do you know yet the potential impact the coronavirus is going to have on census counts and numbers for us?
We're really not sure what the total impact is going to be. We know it's going to be some impact. We're encouraging people as you're at home, go ahead and fill out your census, get it done while you're at home. But then we have a lot of the viewers who are in the area that are the targeted area that don't usually respond to census, may not have a computer at home, may not have capabilities at home. So we're working with both sides to make sure that we get the best count we can.
Let's talk about the business of Huntsville as a city. As you said, the city of Huntsville is open and conducting all those public services. Well, let's talk about closures. Jim wants to know, when are we planning to close the city of Huntsville, or at least city jobs?
We hope not to have to close the city of Huntsville, but it's a day-to-day. We monitor it day-to-day. We have briefings day-to-day, but we hope not to close the city of Huntsville. We want your garbage to be picked up. We want your trash to be picked up. We want to keep policemen patrolling. We want to keep doing inspections, building houses and building industry. We want to do all the things that a city has to do to be in operation. But we're taking some measures, I think, that will help us. We're making sure that we separate. We're making sure that we sanitize. We're making sure that if you don't have to come into City Hall, there's a lot of ways to do it electronically. If you want to bring your taxes in and drop them off, there's a drop box there that you can drop them off. We're doing a lot of things so that people don't have to come in. There doesn't have to be that interaction.
When you look at cities down south, especially in Jefferson County, Mr. Mayor, and you think of the number of positive tests results coming in, this leads to this next question from Brennan. He wants to know why we're not being more firm about local shutdowns and quarantines here.
You know, at this point, we're not seeing the same thing that they're seeing in Birmingham. We have 2 confirmed cases as of now through the Alabama Department of Public Health. One is in Madison County, one is in Limestone County, and that's for the whole North Alabama area. We're going to watch it. We're going to monitor it. You know, this is something we have a strategy and a plan how we're going to take this on. But just as important as we have a strategy and plan, we have to know that that strategy and plan can morph, can change. As conditions change, we'll change.
Such a fluid situation, and we have to be ready for it, as you're saying.
Exactly.
Carlos is now asking, this is kind of linked to this as well, is there a plan, or are we considering a curfew to help fight this pandemic?
Not at this time. And again, it's part of the plan, and it's part of something that could morph into something else. During the 2011 tornadoes, we did a curfew because it was very important. There were no lights on, street lights weren't on, traffic lights weren't working, and it was very important to do that for public safety. If we see a place where there's a public safety concern, we'll consider it, but right now we don't see any reason to.
What would it take for something like that to happen, as far as like a shutdown or quarantine or something like that?
It'd be a huge speculation. It would be a huge number of spikes in the cases that were out there. And we're going to see some additional cases come online. But as long as we can keep, as we say, flatten the curve, as long as we can keep the number of cases very slowly increasing, then we'll be okay, because our healthcare facilities will be able to take care of it, and we won't overburden our healthcare personnel.
Mayor Battle, as you know, businesses are the backbone to an economy. You know that very well, and a lot of them are struggling. So let's go to this question from Alan. He says, as a small business owner in Huntsville, I'm already seeing a 40% decrease in my daily business, as many of my clients are older and are taking extreme precautions by staying at home. So he's asking, are you aware of any financial assistance programs on the federal, state, or local levels that will help small business owners recoup lost income?
Yeah. And to Alan, I feel your pain. I was in the restaurant business back years ago. If something like this had hit, I would have been out of business. I mean, when your cash flow goes from one number to zero, it's very, very hard to survive. There are some good programs out there. The SBA is working with a program with the state, and the governor's just getting that in place that we can work with. There's a COVID-19 fund that is coming through United WAAY. The banks are working with their clients out there. We had a call out to the president of the banks today and just asking them what programs they had in place. Some of them go from interest only. Some of them go with no payments for 3 months. A lot of people are working on this to make sure that we get our businesses through it. Unfortunately, as hard as this is hitting people, it's going to be tough.
Let's talk a little bit more about some of those people that are being hit, Mr. Mayor. Megan wonders what kind of financial assistance is available for Alabama residents impacted by the coronavirus.
You know, I think we're going to see some federal emphasis there, but also we're seeing, you know, we have sent out letters to some of our pastors talking about we need to take care of each other. Part of our mission work needs to be in our own backyard. We need to make sure that we have community chest type activities at every church so that we can help people through this. A lot of the people being hit by this are people in the restaurant industry, the hospitality industry. They may not have the reserves in place to be able to take on no income for 3 weeks. So we need to be able to help with utilities, with rent, with things that that are necessities in life. And also, you know, we're trying to help with places like Manna House and others, Food Bank of North Alabama, who is actually providing boxes of food for people who, quite frankly, don't have the money to buy food. And, you know, it's hard to think of somebody in Huntsville, Alabama not being in that position, but it's true. So we need to take care of each other, and each of us needs to take on some responsibility with this.
Well, and for those who do have the means, Mr. Mayor, I mean, you heard Chip Cherry, the CEO of Huntsville Madison Chamber, just in the briefing earlier today, talking about what a great idea it is. Or he came up with this idea of Tuesdays and Thursdays. Why don't you order takeout from your favorite local restaurants, right?
That's exactly right. Takeout Tuesdays, takeout Thursdays. Yeah. Go do takeout at your local restaurant and tip generously. Yesterday we were in a restaurant and we were the only table there for lunch. And as I left, I tipped generously, because that poor waitress, that was probably going to be her only income for that day, besides the small paycheck she gets.
It's really hard to see these businesses struggle like that, and the people themselves. Mr. Mayor, Rhonda now wants to know what actions are being taken to protect and monitor the homeless in our community.
We started meeting on the homeless and with law enforcement. It was a meeting about the homeless and the jail situation. The jail is 800 people right now, you know, which we're monitoring very, very closely. The homeless camps are not known for the best sanitation in the world. So we've got places like First Stop and Natch and some other agencies working with the homeless and making sure that we have sanitizers down there, toilet paper, paper roll, towel rolls, just making sure that we have enough supplies there for them to actually take care of themselves. It's a tough situation. The folks that we have in the homeless camps mostly don't want to move inside. So they're going to be a place that we're going to have our community resource officers monitoring and others monitoring, just to make sure that that we take care of the needs.
Okay. And we have one more question from one of our viewers, Mr. Mayor. Amy asks, why are some companies allowed to continue to operate under the circumstances of the virus, putting people at risk?
Yeah. You know, one of the things that we're trying to do, and it's a fine line to work, you want to keep companies working because you want people to continue to have paychecks. And that is a necessity in our community and in our society, that we have a paycheck. So we're trying to let companies work, but we're also trying to make sure that we don't spread this coronavirus. The companies and industries have been very good at self-regulating. They have worked very hard to self-regulate, to make sure that we had separation, that we have good hygiene in the plants that they're working in, and that, you know, you might work from home or you might do telecommunicate, and we're doing the same thing in the city of Huntsville. We're trying to make sure that we have on each floor, we have 2 teams, and one team doesn't mix with the other, that we do conference calling rather than getting together in groups, and anything over, you know, 6 people can be done by conference call rather than bringing together a meeting. If we can all be smart and do things like that, then we'll get through this, and we'll still be able to operate in an unnormal time. We'll be able to operate as close to normal as possible. It is a tough time, but I'm proud of the people of Huntsville and what they've done, because they've stepped forward and they're taking this seriously. That's why I think we have not had as many cases as Birmingham and other places have. They're taking it very seriously, and they're doing smart things. We're a smart place, we do smart things.
Mayor Tommy Battle, we thank you so much for your leadership, everyone else out there on the front lines of government, also in our medical community. Hey, before you leave, could you give us some closing words of encouragement and hope as we move forward in the challenging times ahead of us here in Huntsville?
Listen, what I can say to the people of Huntsville and the people of North Alabama, you have done a great job. You have done a great job. We have 2 cases in all North Alabama right now, and there's going to be some more. But we've had 2 cases so far because people have made sure that they followed good hygiene, that they have separated, they have sanitized, they've done all the things that everybody has asked them to do. To each of you, this is a tough time. It's a time when we're all challenged a little bit. But each of us will come through this, and we'll come through this. At the end, I can say this: I'm very proud to be here in this spot and be in North Alabama because everybody is taking on a challenge, and they're going to be a success at it.
Mayor Battle, we can't thank you enough for coming in for us tonight. A lot of good insight in what the city's doing and some of its own challenges in the fight against the coronavirus. Thanks so much.
Thank you.
Dan and Naja coming right back to get more of your questions answered next.
Dr. Patelis, mic check. 1, 2, 3. 1, 2, 3.
Check for this.
Mic check, 1, 2, 3. Check.
1, 2, 3.
There you go. A lot of questions flooded our email over the past few days.
We want to get to as many answers for you as possible, so let's get right back to Dr. Hassoun with Huntsville Hospital's Infection Control Program and Dr. Nicholas Patelis, who is a family doctor. This first question is for Dr. Hassoun. Sue wants to know, how long should you run a fever before getting concerned, and what is the first course of action?
So the main concern, if you start having fever, this could be any viral infection. Remember, flu can do that, other type of viruses. The main concern comes when you start have, for example, increased shortness of breath, where that point you're going to need to start to get in touch with your primary care physician to get advice. Now, I can tell you, if you had been exposed or you start having symptoms, fever, cough, it will be a good idea to be in touch with him about, do you need to be tested or do you need to stay at home, reduce your exposure as well as reduce transmission to others, whether it's the flu or the coronavirus.
Dr. Patelis, this one's for you from Tia. She wants you to explain the reason for all the scare around coronavirus, but not near the attention for H1N1.
So what I would say, it will be a good idea to think about H1N1 was a major issue when we had it in 2009. In 2009, the mortality associated with it was significant. We actually had significant problem of shortage with ventilators. I think the concern with corona is similar, but the transmission with corona is much higher. That's why we worried more about it, if we're going to see more and more of that. But I don't think yet we had issues in our Huntsville area.
I apologize, Dr. Hudson, we're out of time, but thank you. We had a lot of great questions in this half hour.
Yes, thank you so much for joining us. Your health and safety are the reasons why we are all here and dedicated to fighting this together. Complete updates on the coronavirus are available 24/7 at WAAYTV.com. We'll see you at